Tension headache. Imagine you start feeling a tight pressure around your head, almost like a band is wrapped around your forehead or the back of your head. This is called a tension headache, and it is the most common type of headache. Tension headaches usually happen when the muscles of the scalp, neck, and shoulders become tense. This muscle tension can be triggered by stress, anxiety, long screen time, poor posture, or lack of sleep. The pain is usually mild to moderate and often affects both sides of the head. Unlike migraines, the pain usually does not throb. Instead, it feels dull, steady, and pressing. Tension headaches are not usually dangerous, but frequent episodes can affect focus, daily activities, and overall comfort. Migraine. Now imagine a headache that feels much stronger and more intense. The pain usually appears on one side of the head and often feels pulsating or throbbing. This condition is called a migraine, a neurological disorder that affects millions of people. Migraines are linked to changes in brain activity and the trigeminal nerve, which is involved in pain signaling. During a migraine attack, certain chemicals, such as serotonin, can fluctuate, which may trigger inflammation and pain in blood vessels of the brain. Many people also experience other symptoms like nausea, vomiting, sensitivity to light photophobia, and sensitivity to sound phonophobia. In some cases, a person may first experience an aura, which can include visual disturbances like flashing lights or zigzag lines before the headache begins. Cluster headache. Now imagine a headache that causes extreme, burning pain around one eye. This is called a cluster headache, one of the most painful types of headaches. The pain usually appears suddenly and is focused on one side of the head, often around or behind the eye. These headaches occur in repeating periods called cluster cycles, which means attacks may happen several times a day for weeks or even months. Cluster headaches are linked to activity in a part of the brain called the hypothalamus, which controls the body's biological clock. During an attack, people may also notice symptoms like a red or watery eye, a runny nose, or swelling around the painful eye. Because the pain is so intense, many people feel restless and unable to sit still. Sinus headache. Now imagine feeling pressure and pain around your forehead, eyes, and cheeks, especially when you bend forward. This type of pain is often called a sinus headache. Sinus headaches usually happen when the sinuses become inflamed or blocked, a condition known as sinusitis. The sinuses are air-filled spaces located in the forehead, nose, and cheekbones. When these spaces become swollen due to infection or allergies, pressure builds up and causes pain. The pain is usually felt in the face and front of the head and may become worse with sudden movements or bending down. Other symptoms may include a stuffy nose, thick nasal discharge, facial tenderness, and sometimes fever, which help distinguish sinus headaches from other types of headaches. Hormonal headache. Now imagine getting a headache that appears during certain hormonal changes in the body. This is called a hormonal headache, and it is commonly linked to changes in the hormone estrogen. These headaches often occur during the menstrual cycle, pregnancy, or menopause. When estrogen levels suddenly drop, it can affect pain pathways in the brain, which may trigger a headache. Hormonal headaches often feel similar to migraines, causing throbbing pain on one side of the head. Some people may also experience nausea, sensitivity to light, or sensitivity to sound. Because these headaches are connected to hormonal fluctuations, they often appear at predictable times, especially before or during menstruation, which is sometimes called a menstrual migraine. Caffeine withdrawal headache. Now imagine you regularly drink coffee or other caffeinated drinks, and one day you suddenly stop. After some time, you begin to feel a dull and throbbing pain in your head. This is known as a caffeine withdrawal headache. Caffeine affects the blood vessels in the brain. It normally causes vasoconstriction, which means the blood vessels become narrower. When caffeine intake suddenly stops, the blood vessels can expand, a process called vasodilation, which may trigger headache pain. These headaches usually appear within 12 to 24 hours after reducing caffeine. They may also come with fatigue, difficulty concentrating, irritability, and sleepiness. For people who consume caffeine regularly, the brain becomes used to it, which is why sudden withdrawal can lead to these symptoms. exertion headache. Now imagine you start exercising, running, or lifting heavy weights, and suddenly feel a sharp, intense headache. This is called an exertion headache, triggered by physical activity. Exertion headaches occur when sudden increases in blood pressure during exercise put stress on the blood vessels in the brain. They can appear during activities like running, weightlifting, coughing, or sexual activity. The pain is usually short-lasting but intense, affecting both sides of the head. Some people describe it as a pulsing or throbbing sensation. While exertion headaches are often harmless, it is important to consult a doctor if they appear suddenly for the first time or are unusually severe, as they can sometimes indicate underlying brain conditions. Hypertension headache. Now imagine feeling a constant, pressing headache, often at the back of your head or temples, when your blood pressure is very high. This is called a hypertension headache. High blood pressure or hypertension increases the pressure inside blood vessels in your brain. This extra pressure can trigger pain and sometimes cause dizziness, blurred vision, or nosebleeds. Hypertension headaches usually occur in the morning and are often described as dull, steady, or pulsating. They may worsen with physical activity or stress. If you experience frequent headaches along with high blood pressure, it is important to monitor your blood pressure and seek medical advice, because uncontrolled hypertension can lead to serious health problems. Ice cream headache. Now imagine eating something very cold, like ice cream or a cold drink, and suddenly feeling a sharp, intense pain in your head. This is called an ice cream headache or brain freeze. Brain freeze happens when the cold substance touches the roof of your mouth palate. This triggers the trigeminal nerve, which senses facial pain. The nerve sends signals to the brain, causing a sudden headache that usually lasts 10 to 30 seconds. The pain is typically short-lived but very intense, often felt in the forehead or behind the eyes. You can relieve it by pressing your tongue to the roof of your mouth or drinking something warm to restore normal temperature. Ice cream headaches are harmless and happen to many people occasionally, especially when eating cold foods quickly. Dehydration headache. Now imagine feeling a throbbing or dull headache after not drinking enough water. This is called a dehydration headache, and it happens when your body loses more fluids than it takes in. When you are dehydrated, the brain temporarily shrinks from fluid loss, pulling on the surrounding membranes and tissues, which triggers pain. Dehydration can also reduce blood flow and oxygen to the brain, making the headache worse. These headaches are often accompanied by dry mouth, fatigue, dizziness, and reduced urine output. Drinking water or fluids usually helps relieve the pain within a short time. Dehydration headaches are common during hot weather, intense exercise, or illness, and staying hydrated is the simplest way to prevent them. Medication overuse headache. Now imagine taking painkillers or headache medicine too often, and instead of relief, your head starts hurting more. This is called a medication overuse headache, sometimes called a rebound headache. When pain relief medicines like NSAIDs, acetaminophen, or triptans are used frequently, the brain can become more sensitive to pain signals. This causes headaches to return quickly or become chronic, even when the medicine is taken. These headaches are usually daily or near daily and can feel dull, constant, or throbbing, often affecting both sides of the head. Other symptoms may include nausea, irritability, and difficulty concentrating. The key treatment is to gradually reduce overused medications under a doctor's supervision and find alternative headache management strategies. Sleep deprivation headache. Now imagine not getting enough sleep for several nights and slowly feeling a dull or throbbing pain in your head. This is called a sleep deprivation headache. Lack of sleep affects the brain's pain-regulating systems and can increase sensitivity to pain. It may also cause changes in neurotransmitters like serotonin, which can trigger or worsen headaches. Sleep deprivation headaches are often mild to moderate, affecting both sides of the head, and may be accompanied by fatigue, difficulty concentrating, irritability, and mood changes. The best way to prevent these headaches is to maintain a consistent sleep schedule, improve sleep quality, and manage stress, as chronic sleep loss can increase the risk of frequent headaches.